Hi, my name is Dr. Miller, and I'm a director of Central Ohio Functional Medicine Health and Wellness Consulting. I'm doing a series of videos looking at factors that involve normal weight management. And today I want to talk about thyroid and thyroid dysfunction. Thyroid dysfunction impacts normal weight management. The thyroid is simply the thermostat for normal metabolic function. And metabolism really is defined as the process of cells burning food for energy. And the efficiency of food burning is going to impact your weight. So the thyroid gland regulates multiple functions: muscular functions, neurological functions, vascular, oxygenation, digestion, vitamin mineral utilization. And thyroid hormone impacts other hormones. Now, mitochondrial function, you've heard me talk a little bit about the mitochondria, the principal energy source of the cell, is involved in how well you metabolize carbohydrates, proteins, and fats. And these are the macronutrients that are burned for energy or stored as fat. So again, thyroid, thermostat for metabolic function, significant dynamic impact on weight management. There are two main thyroid hormones, T4 and T3. There's a master gland in the brain called the pituitary, and it produces something called TSH, thyroid stimulating hormone, and it stimulates the thyroid to produce T4. T4 is called thyroxine. T3 is called triiodothyronine. Now, the thyroid gland produces 80% T4, and that T4 is converted into T3, mainly in the liver and the kidneys and in cells, but T3 is 5 times more active than T4. Now, vitamins and minerals are essential to every cellular function in the body, including hormone production and hormone metabolism. Decreased production of T4 can be caused by numerous vitamins and minerals. How do I tell which one? Well, I measure for those. I look at how vitamins and minerals impact enzymes that drive various processes, so I can tell whether you have a copper deficiency, a zinc deficiency. I can tell whether B vitamins are involved. The iodine can be involved in the production of T4. Now, the conversion of T4 to T3 requires an enzyme that removes one molecule of iodine from that 4 molecules of iodine in T4, 3 molecules in T3, and that enzyme removes 1 molecule of iodine. And this enzyme can be impacted by many vitamin mineral deficiencies, particularly selenium. But if you have toxic metals, in which we're all exposed to, things like cadmium if you're a smoker, mercury or lead toxicity, those things can affect the enzyme that converts T4 to T3. High stress, elevated cortisol can do that. Certainly, because most of the conversion occurs in the liver or kidneys. If you have any problems with liver function or kidney function, you're going to have decreased conversion of T4 to T3. And remember, T3 is much more active than T4. It's really the most important hormone. Adequate protein intake or iron. Now, many people are on medications that reduce the conversion of T4 to T3. Believe it or not, if you're on birth control pills, and many women who go on birth control pills note that they might have a weight gain. What is the reason? It blocks the conversion of T4 to T3. If you're on blood pressure medication, beta blockers, same factor, blocks the conversion of T4 to T3. If you might have manic depression or something you might have to take lithium for, that would also block that. So those things you need to be aware of. If you cannot adequately convert T4 to T3, your weight management is going to be difficult, perhaps impossible. So there's other factors associated with decreased T3, and there's something called reverse T3. This is the type of T3 that binds the normal receptor for T3. And again, if you're under increased stress, you have high catecholamines, a lot of adrenaline, a lot of norepinephrine, you are going to have problems. Toxic metal exposure or inflammation, and in those inflammatory cytokines, these messenger molecules that cause inflammation can cause problems with T4 as well as, or T3 as well as diabetes. So factors that increase the conversion of T4 to T3, again, as I've mentioned, I measure all the vitamin and minerals that are necessary to do that, and that's a key factor. I don't guess, I test. That's the bottom line. So we can use various botanicals to help sometimes that will be very beneficial. Ashwagandha is one of those. Amino acids, tyrosine, higher protein diet. Other hormones, growth hormone, glucagon, which I've talked about in the last series, melatonin, are all hormones that can impact the conversion of T4 to T3. So there are multiple personalized, specific, functional, evidence-based treatments that we can use, lifestyle, dietary, nutraceutical recommendations, but they're all based on testing. When we test, we pinpoint the problems, then we can develop effective strategy. So the standard of medical care for thyroid problems, they'll give you, sometimes they'll give you a more natural hormone called Armour, but they can give you Synthroid or Levodopa. Sometimes they'll give you Cytomel, those types of medications. But the point is that with functional medicine, you have options that if you have thyroid dysfunction, and those options include vitamin and minerals, lifestyle, and dietary things, dietary strategies, because thyroid dysfunction impacts so many things. Low thyroid dysfunction will definitely, in fact, impact fat metabolism. Low thyroid dysfunction is associated with elevated cholesterol levels, maybe 10 to 50% higher. Low T3 will cause elevation of low LDL, so-called bad guy cholesterol. Even mild thyroid dysfunction impacts heart disease because of the factors I just talked about before, oxygenation, blood flow, and all those things. So low thyroid function, multiple symptoms. You say, what kind of symptoms might I have if I have low thyroid function? Well, we're talking about weight gain. That'd be number one. Fatigue, depression. You could have anxiety. You could have low body temperature, poor circulation, constipation, a number of those types of symptoms. You could have cold intolerance because of blood flow issues. You could have dry, rough skin, fluid retention, swollen legs, sparse, coarse, dry hair. All those types of symptoms really you can have with low thyroid function. So if you have any of those hypothyroid symptoms, you do have weight management issues, we conduct broad spectrum laboratory testing to evaluate thyroid dysfunction. We're going to measure thyroid stimulating hormone. We're going to measure thyroxine and T3. Sometimes in your family doctor, they'll only measure TSH. They may measure T4, T3. Certainly endocrinologists are going to measure T4 and T3. We go a step further, we measure reverse T3 that binds normal T3 receptors. We're going to measure antibodies, antithyroid globulin antibodies associated with inflammation of your thyroid gland. We're going to measure something called TPO. It helps differentiate between hypothyroidism and thyroiditis, really. So there's thyrotropin receptor antibodies we'll measure, and those sometimes will, antibodies will affect your receptors, and that causes Graves' disease. It's sort of like a secondary hyperthyroidism. We'll measure calcitonin to rule out medullary carcinoma. We'll do thyroid or thyroxine binding globulin to see if the thyroxine is bound and it cannot effectively stimulate your cells. So we do all these tests so we can differentiate. And the reason we measure those antibodies, and normally those antibodies may not be measured because they definitely interfere with normal thyroid function. And there are a number of reasons that we can determine poor gastrointestinal function. Believe it or not, sensitivity to grains, gluten sensitivity can impact your thyroid function, inflammation, all those things can occur. So we do complete, thorough testing to evaluate. And so thyroid function is one of the many important diagnostic steps that we try to solve as part of the weight loss problem. So if you're experiencing weight management problems, you've not been evaluated for thyroid dysfunction, you'd like to be tested, you think telehealth consultative care is a good fit for you, please feel free to contact me. Info cofm@gmail.com, cofmhwc.com. You can find more information. Thank you very much for your time.